Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist, and in today's video we are going to talk all about finger sprains. So if you've ever had an injury where maybe you've jammed your finger, it got caught on something, you had x-rays, they were negative, but your finger is still bothering you maybe weeks or even sometimes a couple of months after, you probably sprained your finger. And we're going to talk a little bit about what you can do about it today. Without further ado, let's get into it. So first of all, finger sprains, or sprains in general, mean that a ligament, which is the connective tissue that connects a bone to a bone and holds the joint together and stable, has been damaged. It's been overstretched. Sometimes they will actually tear or avulse off of the bone, which is obviously not great and something that you would need medical help with and medical treatment. But you can also have more of a simple sprain, which really isn't all that simple at all, but it just means that that connective tissue has gotten overstretched. It's been damaged. The bummer about ligaments is that they just don't get great blood supply, so they take a lot longer to heal than a muscular injury would, which is why sometimes these symptoms can hang on for several months. It's also very common that you will have swelling around the affected joint, which most oftentimes in the finger, not always, but most often is around the middle knuckle, the PIP joint. That sucker can stay swollen, can stay enlarged for 9 to 12 months sometimes. It's not completely unusual for that to be the case. So they can be really persistent, annoying injuries. First things first, if you have not gotten your finger checked out by a doctor, you need to do that first. Make sure that especially if the mechanism of injury was traumatic, we want to make sure that there's no broken bone or no fracture. And you also want to have a doctor check to make sure that there is no torn ligament or no torn tendon or tissue. So once you've done that, then this video is helpful for you. If you've gotten cleared, you don't have a fracture, broken bone, you don't have a torn tendon or anything like that, then this video will be helpful. So the first question I get asked a lot when dealing with these injuries is, how can I help with the swelling of that joint? And yes, it is persistent. It will take probably 9 to 12 months for it to completely resolve. So if it's a finger that you wear a ring on, I wouldn't think about getting your ring resized until it's been a year from the injury. But there are a few things that you can do to help take care of excess inflammation and help your joint start to settle down that tissue. One of these things is doing a gentle type of self-massage to help flush some of that extra fluid out. So when we do this type of massage, it's not going to be a deep tissue massage like you would think about for muscles. The lymphatic vessels that take care of the swelling that are in our finger and our hand are very close to the surface. So they take a very, very light amount of pressure to stimulate them. If you push too hard, you're actually kind of crushing the vessels. You're not helping them to flush out that fluid. So I often tell people, it's like you're petting a butterfly's wing, or it's like you're petting an angry cat's tail. You just want to do that sort of very lightly. You always want to start at the tip of the finger and work your way down towards the heart. So we're always trying to push that fluid to recirculate. But you can do this in a variety of ways. You can have sort of this tripod pinch and sort of go down the finger in this sort of circumferential fashion, I guess. That's one method. But again, just very, very light touch. I like to do it with pincher grip. So I like to just do this sort of stroking down the finger, nice and slow. You can do front and back, and you can do side and side. And once you go down the finger a few times, you might actually take that down the back of the hand, and you might even bring it up towards the elbow, the center of your elbow as well. So we're, again, just trying to help flush that fluid out. The second strategy that you can use that's easy to do on yourself is using Coban or Coflex tape. So this type of self-adherent tape that they'll often put on you, like when you get a blood draw or something, they usually will wrap the cotton ball with this Coban tape. So I'm going to just switch the camera angle to show you how you can do this on your finger. Alright, so we're going to tape up the index finger here. So I'm going to use this Coban or Coflex tape. Make sure that you pay attention if you have latex allergies to get the latex-free version. So all I'm going to do is pull a little bit of length from this, and I actually have a pre-cut piece, which is very convenient, but it doesn't have to be exceptionally long. My piece that I'm using, which you can't see super well, but maybe if I zoom out a little bit, there we go. Sorry, this is wonderful camera work, isn't it? My piece is, maybe about a foot long. It doesn't have to be exact, but we want it to be a good length of tape so that you have enough room that you don't have to stretch the tape. Because you can tell this tape is very stretchy, and if you apply it at a stretch while you're applying it to your finger, you're going to actually create sort of a tourniquet effect on your finger, and that's actually going to make the problem much worse. So you don't want to do that. But let me just zoom in again just a little bit. Wonderful. So what you do want to do is take that length of tape. You're going to start it up on your index finger or on the finger that you're trying to tape. And you can tell that I'm leaving a little bit of the tip free so that I can assess for the fingertip color. So when I do this, I always want to make sure that I leave the tip of the finger free so that if it's starting to turn blue or purple, I know it's too tight. But I always want to start up near the fingernail, and then I, just stuck it to itself. And now I'm just going to take it on a diagonal, like so. And you'll notice I'm not pulling it, I'm just kind of just keeping the tape at its natural tension to get it to lay on the finger without it being too tight. So I just do that on the half width, about diagonal, all the way down, and then I just stick it to itself like that, and that creates this circumferential light compression, which is going to help with inflammation of the finger. Something else that can be very helpful as you are continuing to recover from your injury, but still be able to use your hand for some of the activities of your daily life, is to use buddy taping strategies. So that is something that will give the finger a little bit of a buddy system. It gives it sort of a friend to help give it a little bit more stability and a little bit more support. It also keeps it a little bit more protected so that it doesn't keep getting bumped or caught on things as you're doing daily activities. They do actually make buddy loops, which are really nice, especially if you're wearing it for a long period of time. They're kind of like a little neoprene strap loop that is a little bit more comfortable. It's soft on the finger. You can take it on and off a little more easily because it's Velcro. And so, the down and dirty version is just tape, just using kind of this little very thin type of medical tape, which is totally fine and 100% gets the job done. But you do have to sometimes cut it on and off, or it can be like a little harder to, take it off when you want to. And sometimes people fasten it a little too tight and yada, yada, yada. But it totally does the job, but just wanted to let you know there are other options out there. But this tape will work just fine for what we need. So with this tape, again, I'm just going to cut a length of it. Doesn't need to be super, super long because our fingers aren't that wide usually. But if I'm using sort of the index finger as my example, I'm going to tape it sort of to the middle finger so that it has a little bit of a buddy. And you can also do this in multiple ways. You can put one piece of tape sort of around the base. That's probably going to help if the joint affected was the MCP joint. You can also put one piece above. That's going to help probably if the joint was the PAP joint. If you want extra stability, you can put one below and above. Also totally fine option. So all I'm going to do is just start my tape. I'm going to avoid the creases, the IP joints where my joints flex, because if we tape over those, it's going to be really hard to move your finger, and that is not only annoying for day-to-day activity, but we want to make sure you don't lose mobility and get stiff. So I'm going to apply the tape here, literally just buddy them together, and I'm not making this super tight because I don't want to make it feel uncomfortable, but I'm just wrapping it around, and so now I can still move my fingers. I can still use my hand for most things, but now my finger has a little bit of support, so it's going to be held a little bit more securely. So buddy taping, really, really helpful. And then we'll do one more piece just to show you the 2 pieces method. So again, just taking my tape, sticking it here so that my joint creases are free, and then wrapping it around just like so. And again, notice I'm not making this exceptionally tight, because if you make it too tight, it kind of mashes the fingers together, and that can be really uncomfortable over time. But it allows me to get good movement. I can still, mostly make a fist. There's a little stiffness, whatever, but at least I can still use my hand to some extent without provoking too much pain. So buddy taping can be very helpful for these injuries. And the last thing that I will recommend for this video, at least for the purposes of this video, is doing some active range of motion, some gentle stretching and mobility exercises, which will help stimulate circulation to help with healing. It's going to help drain some of the fluid or the lymphatic tissue, the extra swelling out of the area, but it's also going to make sure that we are keeping the ligaments, the tendons, the joints moving, and so that you don't end up with stiffness and like a joint contracture where you can't bend or straighten your finger, which is not an ideal scenario to have. These exercises can be really helpful for that. If you feel like you are kind of past this stage, you probably want to get in to see a hand therapist so they can give you a little more advanced exercise program. If you feel like you're at the stage where your joint is pretty stuck and it's, not really wanting to bend, or maybe it's not wanting to straighten out, you probably want to go see a hand therapist, because these exercises might not be as effective for you. So you may need a little bit more individualized care. But these can be a good starting point for a lot of people. First things we're going to do is bring our hand up. We're going to spread the fingers apart and back together. And just repeating that movement about 10 to 20 times, 3 times a day. Finger spreading. The next movement that we're going to try is to do a claw fist. So bending the tips of the fingers up and down. Same thing, about 10 to 20 repetitions. It doesn't need to be really aggressive or tight. It can be just gentle movement. The next movement is going to be a fist. So bringing the fingers down and then opening. Again, you don't need to clench a fist. It's just doing the movement, gentle. So those could be some nice stretches. The next one is a flat fist. We're going to bring it into the nails showing. So instead of a fist, we'll have the nails untucked and back up. Excellent. And then the last one is going to be a tabletop position. So you're going to bring your fingers down like a bird beak or a duck bill. And again, 10 to 20 reps, 3 times a day. Those exercises will be really helpful to promote this active motion and help keep the joint moving and keep the tissue moving. You should not exercise into pain, so if these are painful for you, please stop, get checked out with your doctor, or get referred to a hand therapist so that they can help determine a better plan of care, or more individualized plan of care for you. That is going to do it for today's video. Thank you guys so much for watching. If you made it all the way to the end, let me know. Go ahead and post a comment below that says finger sprain, and let me know that you made it all the way here. Thank you again so much for watching, and I hope to see you in the next one.